Right now, we are just a few days away from the start of the 2024 Susan G. Komen Race for the Cure. The run and walk downtown Toledo celebrates breast cancer survivors and remembers the lives lost. This year's Race for the Cure is in memory of Debbie Francis. Her husband says she had a pain in her breast and went in for testing. An initial scan showed nothing, but an MRI would reveal that she had breast cancer. And though Debbie died in January, her memory lives on through a nonprofit dedicated to her in love of flying and providing scholarships for women and girls to do the same.
She's saying, I can't believe you're doing all this in my honor. Number one, I'm mad at you over that because I'm not as great as you're making me look. And I would say to her, you know, you're way wrong. You are that great. You're so great, you didn't even realize it. And I get the opportunity now to bring your greatness out to the world.
We're going to share Debbie's story and her legacy tomorrow at 5:30.
We are sharing stories of local women like Debbie touched by breast cancer this week. It's all leading up to this weekend Susan G. Komen Northwest Ohio Race for the Cure. And getting mammograms is essential for early diagnosis and treatment. We give you a look at a mobile unit making mammograms more accessible to women in our area.
We travel to different locations throughout the region where we provide mobile mammograms for women who are of the age of 40 and above, and men as well as women. Allowing them to have that easier access to care, it improves overall health results, and it also increases the chances of catching cancer earlier before it moves on. We always like to say preventative health care is the best health care.
You don't wake up in the morning going, oh yay, I'm going to have my mammogram. But the people here are so friendly and so professional that they try to make the experience as positive for you as they can.
It's more treatable the earlier that it's caught. So in this instance, you'll take 15 minutes to potentially catch cancer and also have that time to receive the treatment that is needed versus procrastinating or finding reasons to put it off and thinking of, I'll get it next time, I'll get it next time. This beats next time. This is next time.
Well, first of all, they need to have a mammogram. That should be done every year. It could save their life. But also, this is just so convenient. I know that they go to other spots, other neighborhoods, and so they're available all over the place. All they have to do is call Mercy Health.
There is always a recommendation to get it done if you have a genetic history of it. There is also the recommendation of getting it done if you feel like you have any symptoms, you're symptomatic. If you are under the age of 40, you can have your provider, or your provider I should say, will submit an order for you. If you have an order and you're under the age of 40, you can have the mammogram done here on the mobile. So you don't have to have an order if you're above the age of 40 and non-symptomatic. Once you step onto the mobile unit, instantly in front of you there is a miniature waiting area. To your immediate right is our registration clerk. You will provide her with your insurance information. She will upgrade your demographics. From there, she will usher you over to our dressing room. You go through the rear of the dressing room to the back, and that is where you will find our mammogram tech. You will go to the back. She will capture all of your images and usher you back into the dressing room. You reclothe and you come back out the front side with our registration clerk and you exit the mobile. Once we collect your provider's name, those images, your images that are collected, are sent directly to your provider.
I used to have to go into the hospital, and when you go there, you're exposing yourself to all the germs and all the sick people, and so this is really nice.
No matter where you see us, if you see us, please take that 15 minutes to walk on and have the screening done, but we will accommodate to make sure that screening is completed that day.
I was told by my doctor once that as long as you have breasts, you should have a mammogram every year.
If it is detected that the patient does have cancer, BCCP will financially cover their cancer treatment. They will contact us directly and we will work and coordinate with them so that that patient can be seen regardless of their financial barriers, uninsured or high deductible.
The mammography unit is a great way to get into some neighborhoods or rural areas where women aren't getting as much treatment.